This is Case of the Week number 7. My name is Suzanne Johnson and I'm a gynaecologist from Southampton. The patient was 32 and had recently developed some mid-cycle pain. Her last period was 3 weeks ago and was a bit heavy. A pregnancy test was negative. This is an ultrasound image of a transverse view of the uterine fundus toward the right. What's the diagnosis? Is it an intrauterine contraceptive device or an intrauterine system, Mirena coil, or an Essure coil, or salpingitis, or transvaginal tape? This ultrasound image is a transverse view of the uterine fundus toward the right. So this is the right side of the uterus, this is the left side of the uterus. Here is the endometrial cavity. And here you can see a metal coil. And you can just see the turns of metal in the coil. You can't in this image see whether this coil extends slightly into the endometrial cavity, but here it passes through the interstitial portion of the fallopian tube and into the normal fallopian tube. This is an Essure coil. An Essure coil is a metal coil in the fallopian tube. It's contraceptive. The coil remains visible even when you turn the gain down. The correct position of the coil includes a small portion in the intrauterine cavity, some in the interstitial portion of the fallopian tube, and some distally in the fallopian tube, distal to the outer uterine contour. A separate coil should be visible in each fallopian tube. The patient's symptoms were incidental, as she had recently come off the pill, having had her sterilisation procedure. Thank you.